3 dead, 1 in intensive care, and a confirmed hantavirus infection aboard a cruise ship in the middle of the Atlantic Ocean. The WHO is coordinating, investigators are probing, and the questions are multiplying faster than the answers. This is a rare but lethal virus spread by infected rodents, and it appears to have found its way onto a commercial cruise vessel carrying paying passengers who had no idea what they were sharing the ship with. The WHO says 1 case is laboratory confirmed, 5 more are suspected, and the death toll currently sits at 3, including a Dutch husband and wife. Joining me now are Sophia Reeves, our economics and markets editor, and James Chen, our geopolitical analyst. Sophia, let me start with you. Is this a genuine biosecurity emergency, or are we watching the WHO manufacture a crisis to justify its own existence?
Thanks, Emma. Look, the deaths are absolutely real and absolutely devastating. Let's not lose sight of that for a single second. An elderly couple and a third person are dead from what is an entirely preventable vector of transmission. Hantavirus does not appear from nowhere. It comes from rodents, infected rodents, on a commercial cruise ship. That is a catastrophic failure of basic sanitation and pest control. But here's what concerns me just as much as the outbreak itself. It's the WHO's positioning in the response. This is the same organization that fumbled the early days of COVID, deferred to Beijing when it should have been sounding alarms, and is now being handed the microphone on yet another international health crisis. Fox News is reporting that medical evacuations were delayed. 3 people are dead, and the WHO is putting out press releases. If a national government had overseen this response, we'd be demanding resignations. But because it's a supranational body, the media just transcribes. I think the fundamental question here is whether we want accountable national health authorities making these calls, or whether we want Geneva bureaucrats running the show from a conference call.
But Sophia, isn't that a bit unfair? The WHO is a coordinating body. It doesn't have naval vessels it can deploy. Isn't criticizing it for delayed evacuations a bit like blaming the UN for not having an army? And James, what's your take on this?
Well, look, Sophia's instinct about the WHO is right, but I think she's making the wrong argument at the wrong time. Here's what I think Sophia is missing. The immediate issue is not institutional architecture, it's the data in front of us. A 30 to 40% mortality rate for hantavirus pulmonary syndrome. 6 cases, 3 dead. That is exactly in line with the worst-case historical data for this virus. What that tells me is that either the patients were identified late, treated late, or the severity was not communicated up the chain quickly enough. That is not a WHO problem in the first instance. That is a shipboard medical response problem. Cruise vessels carry doctors, they carry medical facilities. The question I want answered is what the ship's own medical team was seeing in the hours and days before those 3 people died, and why the escalation to international authorities apparently took as long as it did. The industry carries 30 million passengers a year. The regulatory framework governing what happens when something goes wrong at sea is a patchwork. That's the data story here.
I hear what James is saying, but with respect, that misses the point entirely. Yes, the shipboard response matters. Yes, the timeline of escalation matters. But James, you cannot separate those questions from the institutional framework within which they operate. The CDC runs a vessel sanitation program. It inspects ships, publishes scores, enforces standards. But that program only covers vessels entering American ports. The rest of the world operates on a patchwork of maritime health rules that are, frankly, inadequate. And who sits at the top of that international framework? The WHO. So when James says this is an industry problem, I say fine. But who is supposed to be setting the international standards that the industry is apparently failing to meet? This is exactly what happens when you build a global governance architecture with no real enforcement mechanism and no democratic accountability. You get press releases, you get coordination, you get delayed evacuations, and you get body bags.
Here's what I want to know. Because 3 deaths is a tragedy, but it's also a data point in a much larger question about whether the world is actually prepared for a more serious outbreak. If hantavirus can get onto a commercial cruise vessel, what else can? James, where do you see this going?
The way I see this playing out, there are really 2 parallel tracks over the next 6 months. On the regulatory track, the cruise industry is going to face significant pressure, litigation from the families of the deceased, media scrutiny, and almost certainly some form of regulatory push from the nations whose citizens were affected. The Dutch government, for instance, has 2 of its nationals dead. That creates political pressure. The risk is that the response produces the appearance of reform without the substance, new paperwork requirements, new compliance checklists, without actually addressing the fundamental question of whether rodent control aboard these vessels is being independently verified. On the institutional track, I'd expect the WHO to push hard for expanded maritime health authority. The trajectory suggests this incident becomes a piece of evidence in a larger argument for centralized global health governance. Whether that argument should succeed is a separate question, but if current trends continue, it almost certainly will be made loudly.
Here's what concerns me most, and this is the scenario I think gets underplayed: the public trust dimension. We are living through a period where international health institutions are already operating on borrowed credibility after COVID. If the WHO's response to this outbreak is seen as slow, opaque, or self-serving, the trajectory suggests a further collapse in the public's willingness to take these bodies seriously. And the uncomfortable truth is that we actually need functioning international health coordination. The world is not safer without it, but the world is also not safer with institutions that resist accountability, expand their mandates after every failure, and treat transparency as optional. If this investigation does not produce clear answers about what went wrong, who is responsible, and what specific changes are being made, and I mean specific verifiable changes, then the risk is that the next outbreak, whatever it is, finds a public that has already checked out.
3 passengers boarded a cruise ship and never came home. And somewhere in a maze of maritime regulations, international health protocols, and corporate liability frameworks, the answers to why are going to be very hard to find. Thanks to Sophia Reeves and James Chen, one thing's certain: the WHO had better hope its next press release comes with some actual accountability attached.